heart. Here we have the right atrium, right ventricle, left atrium, and left ventricle. We have the coronary arteries are the first branches of the aorta and the only branches of the ascending aorta. We have the right coronary artery, it goes here. Major branches or important branches are the atrioventricular node artery for the AV node, for the node of Eshuftawara, the artery nodal or sinoatrial nodal artery, the one for the sinoatrial node or the node of Catan's flag, that is between the superior vena cava and the sinus coronarius in the crista terminalis. And the node of Eshuftawara is between the orifice of the tricuspid valve and the inferior vena cava. Alright, and the descending posterior artery that gives rise to the artery that supplies the posterior part of the interventricular septum. So we have 3 major branches. We can also have like the marginal artery or things along that line, the a posterior artery that supplies the posterior part of the heart. Well, this is another stuff, we will see this in a minute. Alright, next the left coronary artery. Here the left coronary artery gives rise to the circumflex and the descending artery. The descending artery is also called the interventricular artery, anterior interventricular artery, because it supplies this interventricular septum. So the interventricular septum is supplied anteriorly by the anterior descending artery and posteriorly by the descending posterior artery. Also, the inferior part of the heart is supplied by the posterior descending artery. The posterior descending artery is like this. I put like points because if this is an anterior view, we don't see it. We see the coronary artery and we see another branch that is the marginal artery, but we don't see the posterior descending artery unless we see a dorsal view, or we can imagine that this is the heart and the muscle is transparent, so we can look through and we are seeing the posterior descending artery. Next, the marginal artery gives rise to the obtuse, the circumflex artery gives rise to the obtuse marginal artery that gives supply to the inferior lateral part of the left ventricle. Another branch of the anterior descending artery is the acute marginal artery. Important anatomical region is the coronary sinus. This is the major, it is the venous drainage of the veins of the heart. They arise here at the coronary sinus. Here, along this vein, we have the circumflex. So if we look posteriorly, the circumflex is passing closely to here. So if we put a catheter or something and we want to pass it through here, if we don't insert it all the way down, or it can stay here in the sinus coronarium, and if we perforate it, we can damage the circumflex artery. So we should be very careful with this. Another thing is the veins that drain to the coronary sinus are first this great vessel, the coronary sinus, is the major vessel, but we have contribution from the middle heart vessel. This middle heart vessel, or middle coronary vessel, is the vein that is in the posterior interventricular septum. So it's accompanying the posterior descending artery, but here is a vein, and it's called the middle heart vein or middle coronary vein. Likewise, in the anterior interventricular septum, we have the great vessel vein, or the great heart vein, the great coronary vein. So great coronary vein, anterior descending artery, middle vein, posterior descending artery. And we also have some veins that do not drain to the coronary sinus, they drain to the cavity of the ventricle or the cavity of the atrium. These are Tabesian veins. These Tabesian veins drain because, let's say, Tabesian veins of the right ventricle drains to the cavity of the right ventricle. Veins of the right atrium drains to the cavity of the right atrium. These are Tabesian veins. The Tabesian veins has well deoxygenated blood, but the most deoxygenated blood that we have is in the coronary sinus. Also, because the heart is the most demand organ that needs blood, so here we have only deoxygenated blood coming from the heart. In the right atrium, we have deoxygenated blood, deoxygenated blood from all the parts of the body, and we are going to mix that deoxygenated blood of all the parts of the body with the deoxygenated blood of the heart. But because the heart has more activity, this deoxygenated blood is more deoxygenated than the deoxygenated blood arriving from the superior and the inferior vena cava. So when we mix, we have deoxygenated blood. We have more deoxygenated blood compared to this, but less deoxygenated blood compared to this, because we are mixing them. So the part of the cardiovascular system in which we have the most deoxygenated blood is in the coronary sinus. And the most common cause of a dilation of the coronary sinus is pulmonary hypertension.